Hello, everybody. Welcome to our webinar this afternoon. My name is Sue Verrilli, and I am the Regional Education Coordinator of the Northeastern Ontario Stroke Network. Thanks for joining us. We're having to talk about our post-stroke transitional care programs and our navigators that are located across Northeastern Ontario. A few housekeeping rules. I'm trying to mute people as they come in, but please mute your microphones so there's no interruptions during this session. If you have any questions or comments, please place them in the chat and I will watch for them and facilitate a question and answer period at the end of the talk. Again, we're recording this so I can have it up on our YouTube channel archived so people can watch it at a later date. We will have handouts and certificates, so please note in the chat you've been asked to change your name in the participants list so we can see your full name, and add your email address in the chat so we can ensure that you get the information that will be available at the end of this recording. So without further ado, I'd like to introduce our speaker. Cheryl Pearman will be presenting today. She is the Stroke Community Navigator working out of Sault Ste. Marie, Ontario, but she will be speaking to the entire program across Northeastern Ontario. So welcome, Cheryl.
Thank you. So we are going to talk about all of the services that the post-stroke transitional care program does offer. I will be, as we go through, there are some site-specific program changes, or maybe some things are offered and some are on hold. So we will address those as we go through. We do have some of our navigators with us, as well as our coordinator with us today, and they will introduce themselves at the end. As Sue had mentioned, if you have any questions, please put them in the chat and we will address everything at the end. So we must strive to work together to allow people who have had a stroke to recover as best they can. And as you will note throughout today, we are very focused on the person who's had the stroke as well as their family. This is their journey and we're supporting them through it. So again, my name is Cheryl Pearman. I have been with this program for 7 years with March of Dimes. In the first couple of years, I was off and on moving around with the acquired brain injury program a little bit, but I'm here and I love it. So this program was initially developed by Rebecca Bose in Sudbury. At the end of this session, I'm hoping that you will all be able to identify the role of the navigator, list the different programs offered by the post-stroke transitional care program, and be able to confidently refer patients to our program. We have 6 different sites, and one is Temiskaming with the Temiskaming Home Support. Sudbury site is with ICANN. North Bay's site is with FARA. Parry Sound site is with the Friends. And March of Dimes has Timmins and Sault Ste. Marie. We also, so with each of those areas, we don't just focus on that one community, we will service the outlying areas as well. So for the Sioux, I have basically from, the Sudbury district border this way up to Wawa and north to Elliott Lake. We have quite a few people from Elliott Lake with us. So we do our very best to incorporate all of those areas. Okay, so we have navigation services, which we'll talk about, and we have rehabilitation programming and support services. We're going to be talking about it all today. Ideally, as a navigator through the post-stroke transitional care program, we initially work with the hospital staff and meet clients at the bedside in the hospital. At that time, we would complete an intake and also provide education. This is also when we can begin to start submitting referrals to other agencies if needed. We then work with the hospital staff and discharge planners to coordinate services prior to discharge. We facilitate connections to all kinds of stroke-based services in the community and accompany stroke clients to appointments. We provide help in finding transportation solutions, in-home nursing, personal care, housekeeping, physical activity programs, and other services offered by various organizations within that community. So we will talk about the referral down the road, but we really like to travel this journey with the stroke survivor and the family as much as we can. We're not the initial phase, but we like to be there kind of as close to the beginning as we can be and follow them through. What is navigation? Navigation in healthcare has been defined as a service provided to break down barriers to specific medical care in a timely manner. Navigation began in the 1990s in the US with cancer patients. The continuum of care extended through navigation by helping improve access to services and to provide education. For stroke patients and families, community navigation promotes timely access to a coordinated delivery of appropriate and individualized services. The post-stroke transitional care program encourages reintegration by lessening social isolation, supporting caregivers, and assisting with symptom and risk management. And it was quite challenging with the social isolation during COVID, but we really stepped up and did everything we can to kind of normalize the process. Best practice guidelines recommends that patients have access to a contact person in hospital or community for post-discharge inquiries and to facilitate referrals to community agencies. Stroke recovery is overwhelming in nature. Patients are not always ready for the information that they need to receive. As navigators, we facilitate client-centered learning from Stroke Engine and Heart and Stroke. We are available when the client is ready to begin. This isn't always immediately following discharge from hospital. We also support the family members when they need it. It is important to address the caregiver role as they often aren't aware of what coming home actually entails. We make this as easy as possible through phone, email, video conference, or in person. We are very much client-centered as all of our programs are completely individualized. We are the point of contact once discharged from the hospital. And this is really, really important to pay attention to because not everybody is ready to take in the information at the same time. Quite often during the hospital's stay, it's very predictable. Everybody knows what to expect, and the education is given, but coming home is a very different story and can be very overwhelming. So we're there to provide the support and the education at that point. Follow-up, fax, and written correspondence to family physicians can include referrals to programs and return to driving. Unfortunately, many rehabilitation programs require a physician referral, and in many cases, the client does not have a doctor. Some clients do not know how or are intimidated in asking for help or bringing up too many concerns during a visit, or when asked to complete forms like the medical history report form for driving. Often these don't get completed when they should be. Executive dysfunction can prevent follow-up with home care providers, the Ministry of Transportation, and others. Missed appointments, the client's inability to read or make sense of forms or mail, being too overwhelmed, a lack of attention or focus can all be followed as a result of the lack of appropriate support. Connecting clients to vocational caseworkers and helping them to find the right avenues for financial assistance and assistive devices, including modified work equipment or consultation with occupational therapists to discuss adaptive aids, compensatory strategies, and exercises to improve function is an important part of the recovery process. We know that quality of life and happiness comes from having a balanced life. After a stroke, this can become extremely challenging. Individuals find that they can no longer do the same things they did before, at least not in the same way. And the people they used to do those things with may no longer be there. As stroke navigators, we can help individuals learn how to get back to their former hobbies or physical activities by helping them adapt or try alternative techniques or specialized equipment. By linking them up with other survivors or peers with similar interests, we may discover different tools, tips, activities, interests, and most importantly, a new social support system. Links with recreational therapists and leisure assessments, as well as touring company leisure centers or groups to show them what's out there, as they may not have been as integrated prior to the stroke, but now find themselves looking for new or varied outlets. And you will see this if a person is no longer able to join the workforce in the role that they formerly had. They may want to explore some different recreational activities and support networks. So we are going to support them through that. Many of the patients and families just want some indication or feedback on how they are doing, and we're pleased to receive encouragement and praise. While false hope is not helpful, an educated, positive, and empathetic approach is beneficial and not always there. Many clients feel they need to improve or regain function more quickly than what's happening. They have a lack of understanding of the brain's functioning capacity. We need to reiterate, reinforce, and emphasize the importance of self-care, hydration, sleep, social brain stimulation, letting them know that the efforts they are doing is meaningful. So we very often see that, stroke survivors are so focused on being able to use the hand the way they had it before, that they're maybe not drinking their water, maybe they're lacking nutrition, maybe they're not getting enough sleep, whereas all of those other components are only going to benefit their recovery. Clients are followed from time of referral through hospital discharge, if that's where the referral came from, through community rehab and beyond. Clients will always be able to access support groups even if they have completed rehab programming. As goals are achieved, clients are able to move up in program intensity, for example, from Stronger for Longer on to Time and then to Fame, to meet new, more difficult goals. We focus on meeting the patients as soon as we can in the hospital. We do, the navigators will do assessments that we'll talk about at the 3-month, 6-month, and 1-year mark, and then post-discharge. And we work with the client to identify target areas. We will provide support to medical appointments if necessary. Quite often they'll have a family member or friend who will go with them. But if they don't, or if there's just, an inability to get their point across, or, they may forget what the doctor has to say, then we can certainly support them during those appointments. So as part of our intake through navigation, we do outcome measures, and this is our best gauge to see how a person is coming along. So while the focus starts on function, physical ability, and shifts to a focus to reintegration and leisure with assessments and interviews. So some of these questions we do ask the general self-rating of health. So we always ask them, and Not very often will we have people say that their overall health is poor. A lot of people are very good. I'm usually good, um, which is a great mindset that people aren't letting the stroke um, define them, if that makes sense. They really separate their overall health from their stroke, which is wonderful. We also do the reintegration to normal living index. And this is 11 declarative statements giving a percentage of recovery with higher scores indicating better adjustment or return to normal living. So some of these questions are, do you assume the same role in your family that you did before your stroke? Are you moving around your home as much as you want to? So you give that a percentage as to how you're doing it. So the higher you get, the more you're doing everything that you did pre-stroke. So it's nice to see those scores generally go up the further out from stroke. We love to see it. We also do the hospital anxiety and depression scale. And this is just a snippet in time indicating how the person's mood is in respect to anxiety and depression. We are absolutely not able to, diagnose anxiety or depression, but if there are flags there, we certainly discuss it with the client and then ask them if they give us permission to discuss those results with the doctor if they're, higher on the scale. We also will do the fatigue severity scale, stroke impact scale, caregiver strain index, and satisfaction questionnaires throughout the process. Not everybody has all of the lower questionnaires, but the top 3 are the big ones that we do every 3 months. Okay. Post-stroke transitional care program brings to fruition a number of best practices recommendations, including patient and family education, interprofessional communication, discharge planning, early supported discharge and community reintegration and navigation, and transitions and post-stroke fatigue, which we do see an awful lot of. Okay, so not all sites have rehabilitation support workers to help with the programming. Some have one rehab worker, some have rehab workers that are shared with other programs or are part-time, and one site has the navigator wearing both hats. So COVID has allowed us to create and expand virtual programming. And as much as there are so many negative fallouts from COVID, I will say that it has allowed us to really jump on the virtual platform and get the services to the people that need it the most. So I use Elliott Lake as an example. Prior to COVID, I would go to Elliott Lake, I would give some information, encourage them to be as physically active as they can. And there wasn't a lot else I could do other than phone check-ins. Now we have our Elliott Lake community stroke survivors participating fully in virtual programming. Cognitive rehabilitation, stronger for longer, grasp, time, and time at home, and support groups are all offered virtually. If client has access to internet and device, we offer virtual first usually. Some clients who are participating in the physical activity program will require in-person sessions to meet those needs. And that was when everything was shut down because of COVID. That was the one area that weren't able to offer at all virtually, but are able to now. The entire program is very client and site dependent. So this is the long list of programs that we are able to offer. There's a lot of them and we're going to go through them. The physical activity program provides continuation of therapeutic services and is supported by consulting with occupational and physiotherapists, and clients have individually designed programs to maintain and increase strength. In addition, range of motion and flexibility exercise are incorporated into a client's routine. All sites are currently running this program. There are 3 levels of GRASP. The occupational therapist will assess the client to determine which level is appropriate and if there are any modifications to the program required. All sites are running GRASP either in person or virtual. It again is client and site dependent. There are some clients with GRASP that definitely need a more hands-on in-person component to do some range of motion to really get the good stretch as part of their program. So we make sure that that does happen. It is run twice a week. As well, each client is given the binder and their program and are encouraged to do it every day at home. And when the client is doing it every day at home and then with us twice a week, we typically will see a really good improvement. Healthy Kitchens is an amazing program. Unfortunately, it was put on hold because of COVID, and Parry Sound is just getting organized to restart this. They're going to be the first one opening up their Healthy Kitchens again. And the group decides on the recipe, contributes some money to pay for the groceries, and they cook it together. It's a really good program to incorporate what healthy living and adaptive aids may look like for being safe in the kitchen post-stroke. Stronger for Longer is a 12-week seated program designed by the Navigator in Sudbury. She has moved now, so it's no longer Robin O'Hara, but she did create it with Lauren Ward, the PT there. The exercises vary in intensity and aim to increase overall cardiovascular health and strength of the upper and lower body. So it is chair-based and it is a full body workout. It does include some sit to stand exercises. However, if the individual is not able to stand, there is an adaptation for that. It's run twice a week for 12 weeks by the support worker. All sites are offering this program. Some sites are running this in person and other sites continue to do it virtually. Time is a 12-week program developed by Toronto Rehab and the City of Toronto, tailored to individuals with a neurological condition such as stroke, brain injury, and MS. It helps to improve energy levels, increase mobility, improve fitness, and increase the fitness level. Individuals, again, attend twice a week where they complete 9 stations in a circuit. It's a 40-minute workout with a 10-minute cool down. The requirements are a person with a permanent physical disability, such as a stroke. They must be 16 years of age or older, and they must be able to walk 10 meters with or without a gait aid. For this one, we do have a physician, PT, OT, or RN sign off on it, indicating that the client is safe to participate in this. Most sites are currently offering time at home. A few sites are just starting the in-person full time. Time at Home is a program that is, again, 2 separate levels. It's run via video with the rehab worker facilitating the video and watching the participants to ensure safety and accuracy of exercise. So the Time at Home program, the rehab worker will put start the video on one screen, but able to watch all the participants to ensure safety. And there's a break in it. And so there's the 2 levels, and within each level, there's a sub 2 levels. So it's kind of like 4 levels for the time at home program, and then it's running virtually, and then time is actually in person. FAME is again 2 times a week for 12 weeks. It was designed by Janice Ng in Vancouver, and it again is led by rehab workers. It has functional strengthening, stretching, balance, agility, and fitness. There is a health screening form that we require to be filled out by a physician, and this is a good solid workout. Research trials demonstrated improvements in balance function, balance confidence, walking speed, leg muscle strength, and quality of life. The group resulted in faster postural reflexes. Reflexes are of the body that uses a first line of defense to recover from a fall. The trial group, had a 30% reduction of falls in participants who had fallen prior to the trial compared to the control group. So this one does, like, some of the exercises are heel toe walking, step ups, wall push-ups, wall sits, and I'm not sure how often we all do wall sits, but if you're doing this program twice a week, you're doing wall sits, and I'll tell you, your legs get pretty strong. The Living with Stroke program was developed by Heart and Stroke, and it provides participants with 6 to 8 interactive sessions designed to assist them and their caregivers with coping techniques with post-stroke life. Right now, this program is not being offered at any of our sites. It is in the process of being completely revamped by Heart and Stroke. We do hope to be able to offer this hopefully late 2022. I know that they have done some trial rollouts with the new program. It's just not available to everybody at this point. Cognitive rehabilitation and life skills. So with this, our occupational therapist will create the program for the client based on both a conversation and assessments. The assessments include the MOCA, Trails A and B, clock drawing, and there's some others in there as well. So once the assessment is done, she then will create the program for the rehab worker and the client to work together with. Again, it's very client focused, and it's what does the client want to improve upon, and focuses on that. So there's so many different areas that they can, memory, concentration, attention, organizational abilities. So if somebody just needs to be able to manage their bills better in terms of organizing them and then being able to pay them, we're able to do that. If they want to work on making their kitchen, for example, more user-friendly, then that's a life skill that we could work towards. Maybe, we're going to keep things alphabetical, or, move things to have better access in the kitchen. We're going to work on reading, writing, cooking, budgeting, orientation. Scanning is in there. It would fall under a lot of these, but a lot of clients who want to return to driving may not have the best scanning skills. And so that is definitely something that can be worked on. Aqua Fitness. There were more than one site that were running this. Currently, ICANN in Sudbury is the only one that is running Aqua Fitness. It's an hour, once or twice a week, and it is designed to improve flexibility, endurance, strength, balance, range of motion, and coordination. This is a super fun group, and they get a lot out of it. It's similar to the time, I believe the FAME, like a combination of the time and FAME program in the water. Our speech and language program is relatively new. This would be probably be our newest program. For this program, The navigator fills out a referral form and sends it to the Speech and Language University Clinic in Sudbury. And then that program at the university picks it up with the SLP and with their students in that program, and they facilitate the sessions. It's a fantastic program. We're able to offer one-to-one sessions, group sessions, and like more of a coffee talk, you know, not a structured communication program, but more of a just casual conversation. So it is wonderful. There is a wait list for it. We're not able to provide that all of the time. We have to, because the university, they're only allowed, well, not allowed, but they're only able to allow us 1 to 2 days a week for all of our sites. So sometimes there's a wait list. Sometimes people are able to get in sooner than expected. They have taken the summer off, and we will resume this in September. Then we have our support groups. So our monthly support group for clients, and family members can join, it's for clients. It's run on the 3rd Friday of the month. Each site takes turns, you know, facilitating this. We come up with an educational agenda at the beginning of the year, and we each take a month and we create a presentation on that. So there's always the educational part of it with conversations, dialogues, questions, comments throughout it. It is so well received. It's really, really quite nice. Some topics include intimacy, diet, pain management, and many others. They are all run virtually. However, we are looking at potentially having some sites join in person with the option of virtual. So they may come into one room and have the group run on a screen. The caregiver support group, it is facilitated by Robin Stainton in Parry Sound. She's the navigator there. She is the only one that runs the caregiver support group. So any of the other sites that have a caregiver that is interested in that, we fill out a form, send it to Robin, and she takes it away. So today it's the 2nd Friday of the month. So today she had the caregiver support group. Very, very helpful to caregivers, especially those that are really struggling with the changes that happen in family dynamics. Yep. Most of our referrals, as you can see, so all of the sites there are, we say how they're coming from. So North Bay has automatic referral from the hospital to the Navigators. So anybody that presents at the emergency department, Danielle automatically gets a referral, and then she will sort them out as to whether you know, it was not a stroke and it was something else, if it was a TIA, if it was a full stroke. So Danielle will go through that. A lot of my referrals come from the rehab floor at the hospital. Some come from acute, but not as many as the rehab. I do have some from community, and some come from the stroke prevention clinic here. Timmins gets most of her referrals from the hospital as well on the rehab floor. Sudbury, most of her referrals come from the IRU. Temiskaming doesn't have a lot of referrals, but they do come from the PT. Parry Sound, referrals come from the OT-PT on the rehab floor in the hospital. All referrals are sent to the Navigator. Ideally, we would like to see all referrals come from, not all, but we would like to see anybody that presents in the emergency department, we would like to get a referral for those so that we are not missing any. Some may be, you know what, it was a TIA, it's completely resolved, I don't need any education, I'm good to go. But if we don't have automatic referrals, then there is the possibility that some people are sliding through. A physician referral is not necessary for a program. Healthcare provider must sign off on time and fame programs, but not the overall post-stroke program. So we don't need proof that you've had a stroke. We don't need your doctor to send you here. Referrals can come from you or your family member. They can come from the hospital, physician, or family, or any community partner. I do get some referrals from the geriatric clinic here as well. This is an example of our referral form. So each site has their own referral form specific, like this is the general, the email at the top will change, the address at the top will change, but this is what we are looking for. We're looking for basic demographics, where the referral came and what the person is interested in, as well as if there's any special considerations that we may need to know, if there's mobility issues, if there's aphasia, all of that. It's good to know right on this first referral form. So our process is that the navigator will receive the referral. We'll meet with the client to complete the intake and discuss goals. So if we are meeting the individual at bedside to begin this intake process, we can talk about the goals then. You know, what would you like to see when you leave here? What if I had a crystal ball, what would it look like? So we can start with some of those goals then. That process continues post-discharge, because as we know, life gets very different at home than in the hospital. So some of these goals may change, but it's good to keep in constant contact with them. We'll have the client assessed by our occupational therapist, physiotherapist for GRASP, cognitive rehabilitation, and physical therapy. The programs will be created with the assessment. Then the rehab support worker will work with the client on that program. And then there's a reassessment, typically every 12 weeks, to gauge improvement. Have goals changed? I did have one individual who came in with mobility concerns, and she wanted to be able to do her laundry more independently. So we worked on that, and she got that down to a fine science. And then she said that she wanted to be able to wash her baseboards better. So that was her goal. We checked with the PT and worked on getting down on the floor, crawling around on the floor, and then getting back up. So while washing my baseboards may not be important to me, it was important to her, and that was her goal. So that's where we go. How to refer. So yes, there's the referral form. But you can call your closest navigator to do it verbally. Fill out the referral form and fax it or scan it to your closest navigator. And those are the two main ones. Like I said, North Bay does have the automatic referral system, but I don't want somebody to not receive services because they don't have a referral form. Call us and do it over the phone, and we'd be more than happy to take down the information and follow up with the client. Here is a list of all of our navigators and their email addresses. Give everybody a minute if they want to find their closest navigator and note their email address. Sue will be sending out our brochure after this. The one change in the brochure, it does talk about a transitional care apartment that was offered. It is no longer offered at any sites. But everything else in the brochure is accurate, and everybody's contact information for phone numbers for the site is on the back of the brochure. Other resources. So part of our role is making sure that our clients are able to do what they want to do. So this can include making sure that Parabus or Handy Transit referrals and access to these transportations are filled out. Quite often they need a PT or an OT to help fill them out and approve it, but it's important that they are able to access transportation. Some of the more rural areas don't have this. If Behavior Supports Ontario is required for some changing in personality and maybe some behaviors that weren't there before, we will certainly do a referral to there. Local geriatric clinics, this is a big one for a lot of us, that we are doing referrals to the geriatric clinics for follow-up and assessment. Home and community care. So if somebody is struggling with showers, dressing, we're going to make sure that the local home and community care is on board to help facilitate that. Housing agencies. This is a tough one. Some people, and it kind of goes hand in hand with the one below, some people are no longer able to work. Maybe they were never paying into CPP, so they wouldn't qualify for that. So we're going to help them make sure that they've got adequate housing, whatever that may look like in the community. So that is a number of different agencies across the north. We're going to make sure that we help them get signed up with ODSP or Ontario Works as appropriate, as well as CPP disability. So we're going to help them access those if they need it. OBEERS, you can be referred from anywhere in Northeastern Ontario, and that's brain injury. It's located in Sudbury. March of Dimes brain injury program. And again, cardiac rehab, if that's an applicable referral, we'll make sure that's done as well. Lots of these may or may not have been done in the hospital if the person is coming from hospital. So some of these are already addressed prior to discharge from the hospital, which is great. If not, we get on top of it as quickly as we can. Okay, who has some questions?
Thanks, Cheryl. That's very informative. There's a number of questions, so I'm just going to start firing them off. The first question was about the SLP program. Is it included on the referral form?
It is not. At this time, it is not included on the referral form, but that is certainly something that can be put down and should be put down in the special consideration, looking for speech therapy.
Okay, and another question around the speech therapy program is it all virtual? Is that why anyone can access it from across the Northeast, because they do everything virtually?
Yes,
including
in connection with our
group. Yeah,
with our program. Yes, they do. The speech and language program in general at the university, they do have some in person, but when it's affiliated with our program, it's virtual.
Right. Okay, great.
I'm just going to speak up, Cheryl, with respect to ICANN in Sudbury, because SLP is located in Sudbury. They will provide some on-site services at ICANN. But for the remainder of the programs, they're providing them virtually right now.
Thanks, Kelly. For those that don't know Kelly, Kelly Didoni is the OT that works through ICANN and is the OT support in a number of the navigation programs across Northeastern Ontario. Next question. Someone was asking about wait time for OT services in Sault Ste. Marie. And I guess maybe you could, Cheryl, talk a little bit about wait times across the Northeast and how that all works.
Okay, we're doing, I want to say we're doing a really good job with it. So typically once we get that referral and know that an assessment is going to be needed, we're going to try and get them assessed quickly. So we have created a schedule where Kelly is, she sets up times that are available, and then we have the assessment done. If it's possible to do it in person, we do. If it has to be done virtually, which right now a lot of them are done virtually, we do that through Zoom. So in terms of wait times for the actual assessment, I just looked at this morning and I believe we have openings for assessments July 4th. So that's not too bad for the assessment. And then it's not too long after that that we've got the program and we're ready to go.
And do you find that your programs all have wait lists as well?
No. Our wait lists for some sites are longer, and other sites, they're pretty good. Right now in the Sioux, we have a wait list for the in-person time. Other than that, we don't have wait lists for any of the other programs in the Sioux. Any of the other navigators that are on, did you want to address wait lists at your site?
I will in Timmins, Cheryl. So we do have currently a wait list, but we were without a worker in the Timmins location for quite a while. So currently right now, Courtney, our rehab worker staff, her schedule is full. So I would say typically right now she's full for the next 3 months. And then after that, we probably have between 5 and 10 people waiting for different programs. So with regards to what Cheryl said, it's kind of neat that we have access to all the different GRAS programs, time programs, because if people are waiting for, say, cognitive programming, we can go ahead and put them into other programs that we have because we're sharing. Well, when I say we're sharing, it's me and Cheryl because we're both March to Dime staff. So we have come together during the pandemic to provide services. Because Timmins was without a staff for so long, we ended up hiring in Sault Ste. Marie to do all of our staff to support all of our clients through Timmins. So with certain programs, there's wait lists, but we do try to make sure that the groups are full. And between our staff in Timmins and in the Sioux, we do have 4 workers. So there's not too bad of a wait list. It's not like anything like 6 months to a year. Would you say that's pretty fair to say, Cheryl?
Absolutely. Yep.
And when you say you share workers, do you mean for all your virtual programming?
Yeah.
Right.
So now that we have Courtney, we're blessed in the Timmins area because now our PAs that were waiting, like some of the clients had to wait over 2 years for service, which is unfortunate due to the pandemic and due to staffing issues. So now we have her schedule's like completely full. So I'd say the next, with Timmins, it's about a 3-month wait list, but still anybody who's on, refer your people because things change all the time. So if somebody is graduating a program or something happens and we have to place that individual on hold, then we put other people in right away. So we're pretty good at coordinating all of that.
Perfect. And Robin, did you want to mention your program?
Yeah, we're currently full for all our individual programming, just because we only have one rehab worker who's part-time, so her schedule is full. There are spots available in, I believe, all of the group sessions. But for something like the cognitive rehabilitation or the life skills, there may be about a 3-month wait.
What's your location, Robin, for everybody?
Parry Sound.
Parry Sound. So you also support the caregiver support group.
That's correct, yes.
Right. Great. Thank you. Is there another navigator on today?
Yeah, so this is Alexi speaking from Sudbury.
Hi, Alexi.
Currently with our programming, we don't have any wait lists. We're pretty fortunate to have 5 RSWs working for us. In regards to OT and PT assessments, we're booking usually within 2 to 3 weeks, which isn't a long wait at all. And the only virtual program that we're doing right now is time, and the rest are all in person.
Okay, thank you. Lexi's out of ICANN and Sudbury, for those that didn't catch that. And I think our other navigators are off on other education training today. So I think that's all we have, right, Cheryl?
Chilla, are you on?
Oh, sorry. Yeah, there's Chilla.
So my name is Chilla and I'm responsible for the Temiskaming area. And I do not have anybody on the wait list other than 2 clients in Kirkland Lake, because I'm in the process to open our gym in Kirkland Lake. So those clients will join the group exercise starting in July.
Very nice. Can you talk about where you would get your, I know you don't get a lot of referrals, Chilla. So which towns would you take your referrals from in the Temiskaming area?
I do Temagami till Kirkland Lake and all around the surroundings. And usually I get my referrals from the North Bay Rehabilitation Center or Sudbury Rehabilitation Center. Usually our client ended up in either or centers, and then that's how I got my referrals. Still in the working progress to get some referrals from the hospital, but we do not have any stroke unit up here. So they just kind of, we are left in the dark, and then we try to figure out how we can get referrals from the hospital.
Great, great. Very good. Thank you.
Thank you.
Okay, next question is about transportation. So does this program help pay for transportation or just organize it?
Just organize it at this point.
Right, so persons that have had a stroke would pay for their own transportation, but you would get them registered and train
Right,
them and
support
help
them,
them
right.
understand the program. Okay.
Yeah.
Thank you. Next question. Do patients qualify for your services only if they are new strokes versus a chronic stroke? And how is it decided rehome care therapy versus stroke program therapy? I think they mean the navigation program when they say stroke program therapy.
Okay, so no, to answer the first part, it does not have to be a new stroke. It can be chronic. It can, we want to help everybody as best that we can. We want people back to living their best life. So if the person has any interest, any goals in any of the areas that we have discussed today, then we will get them assessed and participating in that program. If they don't have goals that are related to that specific programming, but they may be just struggling with some ongoing fatigue or kind of navigating through community programs, for example, like I know in the Sioux, we have VON doing virtual programming for exercising, maybe there are activities. So we would support them through navigation to participate in those programs. So it's very client dependent as to what they want to participate in.
Right, and I know in Sudbury, they follow a bit of a path. So they do their inpatient, acute, and rehab if required, and then they would move to the outpatient rehab program at the hospital in Sudbury if required, and home care at that same time. And then once those are wrapping up, then the programs within the post-stroke transitional care program will start to come into play. So it kind of follows those steps here.
Yeah, the Sioux is very similar.
Right, okay. Now, I wasn't too clear on the GRASP program, so I just wanted to ask if my site wasn't doing GRASP virtually, can I join another site's virtual GRASP? Or is it all the same virtual GRASP that all 6 sites access?
No. Timmins and the Sioux, so March of Dimes, we run our own virtual GRASP groups. We do have some in-person GRASP with those, and then each of the other sites run their own GRASP program.
So everybody has it running virtually?
Yeah, no, Sudbury does do it in person. I don't know if Sudbury has any virtual GRASP. I think it's just in person.
Maybe Kelly or Alexa can jump on and answer that. I just wondered if they didn't have virtual and somebody required virtual, could they do it through North Bay instead or something like that?
So it's Kelly speaking. So with respect to Sudbury at ICANN, we are offering GRASP in person. Most of our programs in Sudbury right now are on site, but for those who are unable to attend on site or would prefer to attend virtually, we haven't had this yet, but we will be offering to those clients to join in virtually with our group on site if they would like that, but we haven't had anyone accepted that yet. So it's still, there is a virtual option, but most of our programs are in site and Sudbury right now.
Okay, great, thank you. Just a couple more quick questions and watching the time here. Do you know what the new Living with Stroke program will be called once it's out, or will it still be called Living with Stroke so people can kind of watch?
It will still be called Living with Stroke.
It will. Okay.
Yep.
That's
Yep.
good. And when you talked about your support group and your caregiver support group, they're run virtually. And so is it one group for all 6 sites?
Yes.
Right.
Yes.
So somebody in Sudbury and Timmins and the Sioux will all be on the same support group call.
Absolutely, which makes it's very beneficial because people in the Sioux may have a different perspective than people in Parry Sound. So it's really good to be able to allow those different perspectives on the same topic.
Right. Perfect. Great. So is there any other questions from anyone?
Just to add to the monthly support group, Sue,
Yeah.
we do take turns as navigators. We kind of ironed out with Kelly, like a list of topics for the year, and then we kind of take turns to facilitate that. And as Cheryl said, the perspective is very, it's very good that they can access different communities. But what I'm finding with a lot of, we have a really good turnout with our monthly support group too. So I'm noticing that if somebody's living in Timmins and they have questions about, say, pain management, different types of services, like even Botox that they've ended up using, then they're able to actually know what Parry Sound has to offer, Sault Ste. Marie and all the other sites. So I feel like that's actually been an added bonus as well by keeping those sites together in the monthly support group, because at the beginning of the pandemic, we did really well with trying to get all the sites doing, the grass, the time. Actually, we didn't have the time at the beginning, but the different programs that we did have, we were running them across all the sites at the beginning. Once the pandemic and restrictions started to lift, we kind of went site specific. So with the support group, it's nice that we keep it together. And we do that monthly, and it also allows the navigators to bring it's a different perspective, and it's a different navigator providing the support group depending on the month. So that's been a real success in our program as well.
Right, great. Thanks for clarifying, Amanda.
Yep.
So I think that's all the questions we have in the chat. It's 1 o'clock. I have Terry and I have both put in the survey evaluation links. So if you can just click on it and take you 1 minute to fill out the survey. That would be helpful to myself and to our speaker today. I'd like to thank you for joining us, and we will send out certificates and the handouts and a copy of the brochure with those that put their emails into the chat. So we'll stay on for a few more minutes for those that want to add their email into the chat. And finally, I would like to thank Cheryl for presenting to us today and sharing information about the post-stroke transitional care program and about all the navigators from across Northeastern Ontario. It's really an excellent program. I've had a lot of experience with it, and we're so glad that it's really flourishing, especially in these pandemic times. So thank you very much, and I hope everybody has a great day.
Thanks. Have a great weekend, everybody.